Hello, this is Jim Slidham. I'll be presenting So You Want to Be a Contact Lens Provider. It's a 1-hour CE that's brought to you from the NAO and the National Academy of Opticianry. And there's my email address in case you want to email me and ask me any questions about this. It's pretty self-explanatory. I will, as I go through here, highlight some of the things that I've done in my own career so that you can understand that opticians can be contact lens providers, okay? And move into the first slide here, and I want to give a little disclaimer that I am a full-time consultant for ABB Optical Group now. I work out of my home and design contact lenses from my home. Did it clinically for many years and fitting well over 20 years of that. And now the NAO has sponsored this continuing education credit for you to be able to take this online. And without further ado, here we go into the presentation. So what's needed to be a contact lens provider if you are an optician, or even if you're another eye care professional? What's needed? Well, of course you're going to need some equipment. We'll talk about the equipment that you'll need. Of course you're going to need training and education, and we'll talk about where we can get that as we go through the presentation. And you need to develop business relationships. You need referrals. You need business relationships so that you can help develop your skills, because there are other fitters out there that will have some suggestions and some thoughts and let you know about products and innovations that are out there for fitting contact lenses. And do you need to associate yourself with opticians, optometrists, ophthalmologists? Yeah, probably all. Probably all of the above, and we'll talk about that a little bit too. And you're going to definitely need to be a problem solver. Anytime you put an object on the cornea, which you'll be doing with a contact lens, there can be issues as far as comfort, there can be issues as far as health, there can be issues as far as vision. And all of those things, if you have a problem in that area, you're going to need to be a problem solver to help solve that for the patient. Okay? Well, let's talk about a little bit of history here. Contact lenses were developed by mostly opticians and optometrists in the very beginning. And they tried scleral lenses as the first choice, and then they discovered you could have corneal lenses later on in the 50s. And in the 60s, contact lenses in PMMA have become fairly popular. Okay, so who's currently teaching contact lens fitting? It's not easy to find a lot of, there's a whole lot more information on spectacles, there's a whole lot more information on products, but the actual fitting of a contact lens, who's actually doing that? And we'll talk a little bit about that too as we go through here. There are some sources. Okay. What amount of time is devoted to contact lens teaching? In most of the schools, not much. There's so many other things that have to be in, especially in optometry school, where most optometrists want to fit contact lenses. There's so much time spent on diagnosis of disease and disorder, treatment of disease and disorder, and in some cases, in some states, minor surgeries. So that has all changed, and the instrumentation has changed, and boy oh boy, there's a lot of time spent in pharmacology now that never used to be spent in pharmacology. Okay, why specialize in contact lenses? Well, I can tell you from a personal experience that I have specialized in contact lenses for the last 25 plus years, and I've done quite well, because most people don't specialize in contact lenses. They also have it maybe in their practice. They may offer some contact lenses, but most of them don't specialize and become specialty contact lens fitters, and we'll talk about specialty products too. Okay. What are you going to charge in fitting fees? Everybody seems to want to apologize for their fitting fees for contact lenses, but they are time consuming. So those fitting fees need to be adequate. Otherwise, everybody says contact lenses aren't profitable. Well, maybe they're not profitable in a practice because that practice is not charging enough for their fitting fees. Okay. So the cost of the lenses is also out there. You'll have to pay something for the contact lenses that you fit. and whatever you charge above and beyond that cost is going to be your margin or your profit. So we'll talk about that also. And how about time spent fitting and or dispensing lenses? You'd better charge enough for the more difficult fits, the more time-consuming fits, than you do for the simple fits. You need a fee structure that reflects that. Every contact lens fit is not the same. So you need to take into consideration, and some are even hard to teach on. Scleral lenses are out there and gas permeable lenses now. And you're going to have to teach the patient how to put that lens on, how to take that lens off, how to care for that lens, and it's very time consuming. It's a very time consuming process because you got to teach them to fill that bowl with non-preserved saline, don't spill any, keep their head down, put it on without tipping the lens, and there's a lot of time involved in teaching this patient, and also removal is quite different than standard lenses. So if you're going to get into specialty lenses, you better charge more for your fees, okay? And also, you're going to have some space. Some of that time that you normally would spend dispensing glasses or fitting glasses, or maybe even if you have a eye care professional in your practice, maybe that time that was spent using that refracting lane will be taken up for contact lenses, and you're going to need some space for that. And also, now we get into why fit soft lenses in single vision or multifocals. Probably the number one reason that soft lenses are fit more frequently is they say they're initially more comfortable than putting on a rigid lens. That's true with the exception of scleral lenses. Scleral lenses, I think, are more comfortable actually in GP lenses than soft lenses are, because what you feel in a soft lens or a GP lens is with your lids is where you feel most of the sensation. And if it's tucked up under the lid, like in a soft lens that's 14 millimeters or bigger, you usually don't feel it as much. Well, you get into these scleral GP lenses that are 16 millimeters, they are very comfortable also. You don't sense them on the eye. So trial lenses are the second reason probably, because you can reach on your shelf now and find something that is going to allow the patient to see, and you can also check the fit immediately in the office. So trial lenses are a good reason for having soft lenses to fit. Okay? So they are more than a corneal lens fit, meaning you're only fitting the cornea, not the entire eye out into the sclera. In a GP lens, it does take a little more time to get accustomed to the feel of that lens in your eye because it does move more, and you do sense it with your lids a little more. Okay? The soft lenses also, because you have these trial lenses on the shelf, you can actually make your changes immediately in the office. Before they even leave the office, you can make changes in what they need as far as power. You can make changes as far as what they need in fit. Just so however they test, you're going to be able to have them leave the office probably with something that is dispensable. And so also, if you need to make a change when they come back for their follow-up visits, you've got different lenses on the shelf. If you discover you should have had a different base curve, or you should have had a different diameter in a lens, or maybe even a different material, you can go grab that off your shelf, try that on the patient, and send them away for another follow-up visit later. Okay? And of course, if we're going to have multiple follow-up visits, then we need to have a little higher fitting. Okay. After fitting and dispensing frequent replacement lenses in soft lenses, did you give them an annual supply? Did you figure out, are you going to have these in inventory so you can give them an annual supply? Some places want to have inventoried lenses. Or you may just give them a trial pair of lenses. You may even give them the second trial pair of lenses. And if it's a weekly disposable or a daily disposable, then you probably will give them a second pair of trial lenses, or a second set of trial lenses. There may be more involved than just one pair if it's daily disposables. But then, did you have them go online and while they were in the office order their annual supply to be shipped to their house, which you can do. You can also set them up, if they only want a 6-month supply, let's say, you can set them up to have a reminder coming directly to their email or their text message that says, hey, it's time to order the rest of your supply. And did you do that? Did you set it up so that they could? Or are those people going to walk on you because you only sold them a month's worth, or you only sold them 6 months worth, and you didn't set them up to get the rest of their supply? Okay. What about patient loyalty and soft lenses? Well, those 6-packs are available just about anywhere. You know, we've got 1-800 numbers they can get it from. We've got different pharmacies that will sell them those products. So, do you build loyalty with the soft lenses and 6-packs? Probably not as much. And they are going to shop around. Everybody goes on the internet to see what pricing is there. Okay. So do you have a website so your patients can purchase their supply? Or do you make them come into your office to buy the rest of their supply? Some people used to use the argument of, oh, I could sell them a pair of sunglasses when they come back in, or I could sell them another pair of glasses when they come back in. Maybe, but most people are so busy they don't want to come back in your office. They'd rather go online and do it. Did you set it up? There are laboratories out there that supply these lenses. They're distributing outfits that can distribute these lenses for you. They can even put a mailing label on there that looks like it comes from your office when it's shipped direct from the provider. Not you, but the person who warehouses these soft lenses. This company can send them to the patient, and the patient goes on your website, they order the lenses, they come to them with your label, and pretty neat that they think that it all came from your office, when in fact it came from who knows where. Could have come from 2,000 or 3,000 miles away. Okay. Direct ship to the patient, or do you have to come in the office for the supply? Convenience, convenience, convenience in soft lenses. They're getting the soft lenses because they're more comfortable. They're also getting them because they're more convenient to order. Okay. Are you competitive in your pricing? And how do you know if you are? If you're dealing with a contact lens company that supplies contact lenses and our distributor for all the different kinds of soft lenses out there, that the question you need to ask is that company providing you with information on what your competition is doing. Your competition being the Walmarts of the world, the Costco's of the world, the 1-800 places they can order their contacts, other online suppliers. Are you competitive in your pricing? Well, if you've got a good company that's keeping you informed on this, they will have a quarterly at least update on what's being charged by all your competitors, so you'll have an idea of what you should be charging to be competitive. Okay? So fitting fees for soft lenses. Okay, what are your fitting fees? $100? $150? $200? Who knows? How did you pick that? Did you pick that from the air? Did you look at your overhead costs? Okay, so do you have different fee structures for maybe a simple spherical single vision fit versus a toric fit versus a multifocal fit? And now we have irregular corneas, people that have real diseased and disordered eyes. What are you doing to charge them? They're much more difficult to fit and make see. Are you charging higher fees for that? If you're not, you should be. Okay, how are you going to set your fee structure? What you going to do? A lot of these things that I'm bringing up I'm not going to give you a complete answer. This is something you need to take into consideration because every part of the world is different. Overhead costs are different. So insurance costs are different. All of those things are different. So how many visits after you've looked things over are you going to provide for this patient? And sometimes, not just provide, sometimes as a troubleshooter, if it's not working 100% on your first go-round, you're going to have them back several times to try to get it fixed. So do you think you're going to average 2 visits, 3 visits, 4 visits? How many on your follow-up visits? Depending on what the situation is and what type of lens you fit, there could be multiple visits. You better set your fee structure accordingly, okay, and cover that. And you need to average that over a group of patients because some are only going to take 1 or 2 follow-up visits. Others may take 6 follow-up visits before you're done. So you need to average that and figure out, okay, this is what we're going to charge on the average for every patient. That way, the patient who only took 2 visits pays a little more, and the patient that took 6 visits has paid a little less for each visit. Okay? What about guaranteeing the fit? Are you going to guarantee that that these contacts work? You know, they're taking a chance just like you're taking a chance when you fit contact lenses. And I can tell you that back in the day, when I had my when I was doing this clinically, I never gave money back on contact lens fits. The only time I ever did is if we were not getting along. In other words, if the patient and I had a disagreement or whatever, and I just didn't want them back in my office, that was the only time I ever refunded, and I can count them on one hand. Now, for all the years that I did it, I can count those patients on one hand. What I did do, since we had eyewear that we dispensed, we would guarantee that they could take the money that they paid towards their contact lenses and apply it towards a pair of glasses. Now, you can decide whether that includes the fitting fee or just the cost of the lenses. That's up to you. But money back, if the patient has nothing invested, they probably don't look at it. They look at it as a commodity and not something that they're going to try very hard to make work. Because if they feel like they're never going to lose any money and they're always going to be covered, they may just bring those lenses back to you. Okay? And so you need to take that in consideration. What are you going to guarantee on that fit? Okay? Money back, exchange for glasses. What's your policy going to be? What's it going to be? Okay? You have to decide. Okay? Are soft lenses profitable? Well, let's talk about it. So how much do you mark up the box? Do you mark it up by a percentage? Do you mark it up by a dollar amount? What do you do on each 6-pack that you sell that patient? You better look over your competition, see what they're selling, and you better not be too much higher than them, or they're going to walk on you. Okay. So, are you charging the same? Are you charging more than your competition? What are you doing? What's your decision on that? Okay. So you want to charge 10%, 20% markup on your lenses? You want to charge 10%, 20% more than your competition, or you want to keep it the same as your competition? You've got to make those decisions. That's all going to build into your profitability. Okay. Does your provider lab of contact lens furnish the information that is needed to know if you are competitive and or profitable? So not only do you want to know what your competition is doing, what are you charging and how much should you be making on every set of lenses that you dispense? And you know, the lab that provides you these products should be able to provide you the information on profitability as well as what your competitors are doing. And if they're not, change labs. Change labs. They're going to help you. They want you to be successful because when you're successful, they're successful. So you need to know that. You need to absolutely know that. So there are more competitors in soft lenses than there are in GP lenses out there. So know that you're going to have more competition. So you better be on top of this. You better know this. Okay? So why fit GP lenses? They're more difficult to fit, right? You got to know more. You know, the patient has to get used to the lenses, so forget them, right? Well, let's talk about profitability. You never have to deal with 1-800 6-pack. The 1-800 suppliers out there, you don't have to deal with as much. In other words, they don't usually do GP lenses, and if they do, they're probably not going to do a very good job of it, so that patient's going to be back in the door getting their GP lenses from you. Okay? Do you retain your patients more because of that? Absolutely. They are much more loyal. They stay with you. And I used to have patients that traveled from overseas to come see me once a year with GP fits. Can't remember that happening with soft lenses and 6-packs. Can't ever remember that happening. Okay? Does it improve your bottom line because these patients stay with you and that sort of thing? Yeah, I think it does. I think it does, and we'll show you a little bit of that. Can you get better visual quality? Think about soft lenses. What makes a soft lens soft? Is most soft lenses are 50% water or greater in their content nowadays. So if it's half water, it's kind of a fluid view that they're looking through. And there's no tear factor behind that soft lens to correct the irregularities on the cornea. So the astigmatism that needs to be corrected needs to be corrected through a toric soft lens, and you don't necessarily need a toric soft lens in a GP. Spherical lenses will correct tremendous amounts of astigmatism as long as they're not tilted on the cornea, as long as they're fitting properly and the tear level is, the tear layer behind it is even, nice and even. You're going to get lots of good correction because the tear factor behind that GP lens has the ability to bend light just like the plastic does. So you are going to be able to correct vision better, and it's more of a natural normal vision because that rigid piece of plastic is not a fluid that they're looking through. It's not quite like looking underwater when you're swimming, but it has a little bit of that effect in a soft lens. Okay, so GP lenses are not absorbing. They don't absorb anything they come in contact with. Soft lenses absorb everything they come in contact with. They're like sponges, so they're much healthier to wear. Okay, so you got better vision, you got healthier eyes. Okay. So also in some states you don't have to give out as much information as you do in soft lens fitting. Soft lens fitting, if it comes in a 6-pack, is truly a commodity. So if you've custom made a GP lens, you don't have to share all the information of what modifications you made with that. Basically all you have to share is power, base, curve, and diameter. And if you made a lot of modifications in the peripheral curves and that sort of thing, you do not have to share that information, and that person is locked into your practice. Okay? Is there profit in GP lenses? Well, let's find out. Let's find out. So let's say that in single vision lenses that you do 3 new fits a week in GPs. You decide you're going to be this big GP fitter, so you fit 1 every other day. That's not a lot, just 1 every other day. And let's say that you charge $280, and that includes the cost of the lenses and the fitting fee. Let's say $280 is what you charge. So 3 fits a week would be $840 that you took in. Okay? And you did that 48 weeks out of the year. Out of those 52 weeks, there's going to be 4 weeks you're not going to be in the office. Okay? So you took in $40,320 over that 48-week period, doing 3 a week. Okay? Your average cost of the lenses was $70 for a pair. Okay? And that's with warranty. It's warranty on the GP lenses. And so your cost was $10,080. So your gross profit, that's before overhead, just basically your cost of goods sold being subtracted out of what you took in, will be $30,240. Now you'll have to figure out what the true profit is based on what part of the world you live in, how expensive your rent is, how much your insurance is, how much the lights cost, etc., etc. Okay? So let's say that you decide you could fit 2 patients in multifocal lenses, that you've got some patients that are presbyopic coming through your practice, and you decide to fit 2 pair of multifocal contacts, and you charge them $650 for the fitting, because they're going to be more visits of making slight corrections in the add power or the distance power or the distance zone size or the the near zone size in that multifocal lens. And so you end up with $650 times 2. You fit 2 patients a week. You did that for 48 weeks. There's your cost of goods sold at $170 a pair. Okay, they cost you more. So there's $16,320 that cost you in your cost of goods sold. So your gross profit is $46,080. Okay, that's before overhead again. That's your gross profit, not your net profit. Okay, so then you decide to find out how much you made out of these 5 fits a week. That's 1 a day, actually. You're doing 3 single vision lenses. You're doing 2 multifocal lenses. So you after cost of goods sold, you took in $76,320. Not too bad. I think you could be profitable even with your overhead costs. Remember, you're still selling glasses. Some of that space is being used for both glasses and contact lenses. So it's not like you had to go out and you're only fitting contact lenses. Okay. So soft lenses. What if you only charged the cost of the lenses so you had 0 profit in the contacts? Some people are doing that. They're just charging whatever it costs them. Okay? So you charged $100 for your fitting fee, let's say. That's on those 6-pack lenses, which are pretty easy to fit. You just decided on single vision spherical simple fits. that you charge $100 in your fitting fee, okay? So you fit 8 patients a week here because you're going to fit a lot more soft lenses than your RGP lenses, okay? So $800 times 48 weeks is $38,400 if you made not one dime on the boxes, okay? So let's say you add $5. You say, okay, well, if I'm going to be competitive, I can't charge more than $5 more than my cost, because that's about what my competitors are charging. So that's what I'm going to charge. So how much more did you make? You moved the $38,400 to $44,080, so your additional income was $7,680. Not a tremendous amount. So actually giving them away versus selling them for $5 more a 6-pack than your cost didn't net you a lot more profit, didn't give you much more profit, okay? Your gross profit didn't go up by much, okay? So let's talk about it. So you got $44,080 profit on the soft lenses in the 6-packs, okay? You got $76,320, okay? That's 5 patients a week. So your total profit is $120,400 in contact lenses. Now that is, again, gross profit. That is not net profit. You haven't gone in and figured out what your rent, lights, and utilities and all that sort of thing are, okay? So if you need a refracting lane, if you don't have one, which you will need to be able to do contact lenses, you really need a refracting lane. That's going to cost you around $50,000 for a slit lamp, phoropter, keratometer, etc. You can buy some of the equipment used, and so probably the average lane cost is around $50,000. You can argue that it's more, you can argue that it's less, but if you are frugal and shop around, you probably can outfit yourself for that. Okay. Now, if you're going to go into specialty lens fitting, especially some of these more difficult fits, you might need a topographer. In fact, you will need a topographer. And it's about $12,000 for the average topographer. Okay. So now you've got $62,000 invested. Okay, but maybe you had the refracting lane anyway because you had an in-house doctor that was working with you. Maybe you're working for an optometrist or an ophthalmologist, and so that cost was already covered before you got there. So really the topographer is your only additional cost. Don't know. Everybody's setup is different, so you have to take all of that into consideration. Okay. So how do you pay for this expensive, terribly expensive, $12,000 topographer? So let's say that you have 13 of those fits a week that we talked about, and you added $10 to your contact lens fitting fees. Okay, you did that over a 48-week period. You would take in $6,240 more money that would go towards your $12,000 topographer. So you would basically have it paid off in less than 2 years. Okay. What if you decided that for every exam that came through your place, and let's say you did 15 exams a day, and most places will do that easily a day, 15 exams a day, you added $5 to your fees for an exam. Okay, whether it be contact lenses, whether it be glasses, whether it be whatever. So you would take in $18,000 a year doing that annually. Okay. So your topographer would be paid off long before the year's over, and the rest would be profit. Okay, so you might do it as routine pre-testing, and when you do your auto refraction, you just do it to topography. Maybe that's the way you approach it, and that way it's paid off a lot sooner. Also, it shows the patients you have higher technology in your place. You can show them the pictures that you've taken, and you're also going to turn up some irregularities in those corneas that you didn't know about when you start taking maps of the eyes. Okay, and the average life expectancy of a topographer, if you want to stay current, if you want your topographer to be basically to remain state of the art, is about 6 years. You'll need to replace it about every 6 years. So 18,000 times 5 years, roughly, is what your profit's going to be if you did that adding $5 to your eye exam fee. That's not bad. That's not bad. Okay. Irregular corneal fitting. Okay. Are you going to do some of that? You're going to need a topography to do so you can see what you're dealing with. Okay. You're going to need referrals, both from practitioners and from patients. Patients that have irregular corneas are so thrilled because you're going to make them see where they couldn't even pass a driver's test with a pair of glasses. With these irregular corneas, you're going to fit these lenses on there that allow them to function and see, and probably have a job where they didn't have a job, or they had a low-paying job. They can move up because their vision has been improved dramatically. So it's quite rewarding in more ways than just monetarily. Okay, but you're going to need referrals. The word's going to have to get around that you like to fit these irregular corneas and that you're good at it. Okay, so your fees are going to have to be greater. Instead of that $100, $150, $200 fee, you're going to need a $500 to $1,000, or maybe even higher. Wow! On these very irregular corneas and scleral lens fits, yeah, it's not unusual to charge a $1,000 fitting fee. That's not unusual at all. So you know, it doesn't take long to recapture a lot of the costs on your equipment and everything else if you do that. But you're going to need experience. You're going to need to understand all the different types of contact lenses. You're going to need to understand the ramifications of the fits, what happens when you fit a certain type of lens on a certain type eye. And this all takes education. This all takes experience. So you're going to need to get that experience and that education. Okay? So you, as an optician, probably you need to be associated with an MD in some respects, okay? Because those are the ones who are seeing more irregular corneas, because people go to them, whether it's right or whether it's wrong. There's probably optometrists that could do just as good, if not a better job, than the MDs in contact lens fitting for these patients' needs. But most of them start at the MD's office because they want to go to the specialist, to the medical doctor, with this irregular cornea. And referrals from them are just kind of going to be a must. You've got to build that reputation where you can get these irregular corneal fits. Okay. So education and treating is needed. You know, where are you going to get it? What you going to do? Okay. There's plenty of textbooks and online training out there. Especially, you know, I'll give you a few hints. The National Academy of Optistry has online training for contact lens fitting that we're doing now. We just got started in doing that, so this is one of the things that are going to be online for you to learn about contact lenses. The other thing is tremendous. They have a lot of textbooks. There are other organizations that have textbooks too. Research it, research it, research it. Okay, and online training from Contact Lens Society of America in their university. You can go get it there, both basic and more advanced. Okay, there are accredited schools out there, whether it be optometry or whether it be optistry. And there are accredited schools out there for teaching you some contact lens fitting. Okay, look into to getting educated. Okay, how about basic NCLE certification? How about advanced NCLE certification? So you can study for your NCLE certification, and then once you have done a little clinical experience and that sort of thing, it's much easier to pass the advanced test. And you can study for that. And there are books, and National Academy has books. There are programs for learning it online, which I've already mentioned. And just learn it, learn it, learn it. Clinical experience, you're going to have to affiliate yourself with probably an optometrist or an ophthalmologist that allows you to get involved in the contact lens fitting. And that's very important. So be sure and you've got to have clinical experience. Otherwise, textbook learning is not the only thing that you need. And you can get that advanced NCLE. You can even become a master optician and master contact lens fitter now from the National Academy, National Contact Lens National Contact Lens Examiners. NCLE gives you that. You can become a fellow in the Contact Lens Society of America with clinical experience and passing the advanced test and taking their practical. So you can become a fellow, which I am a fellow in the Contact Lens Society of America, and so that's something that you can look into. Continuing education conferences, boy, there's some good ones. There's one every year at the Global meeting in Las Vegas. It's called the Global Specialty Lens Symposium, and I would highly recommend that one. That's one that you ought to go to. There's also contact lens training at CLSA. Contact Lens Society of America does that at Opticon, which is given every year through ABO NCLE's meeting. Okay, you ought to go to those and learn everything you can possibly learn about contact lens fitting. And associate yourself with fitters. If you go to these conferences, you're going to meet these people. You need to talk to them. You need to develop a relationship with them so that when you get into these difficult fits, in your laboratories, what a great resource. You can actually work with the consultants at the laboratories and learn from them. They're going to be designing the lenses, so you can learn basically why they are designing the lens the way they are and how that benefits the patient. Okay. So minimum equipment needed would be a keratometer, and we all know what a keratometer is. It measures the corneal shape in a 3 millimeter zone. Okay. Slit lamp, which is also a biomicroscope, a good way to look at the eye. There's a Burton lamp, and there's a new version of the Burton lamp that's a little portable Burton lamp that's much smaller. It's a ultraviolet light or a white light. You can do it either way. And it's got a magnifier, so you can just hold it up to the patient's face. You can do that in the dispensing room. And it's nice and lightweight now, and they're much smaller. They're not as big and bulky as they used to be. I own the big bulky ones, but there are the smaller ones that you can carry with you from location to location, from room to room. It's really really nice. They're very lightweight. Okay. You need to be able to have some kind of a Snellen chart, a wall chart, whether it be electronic or whether it be just a chart on the wall so you can test their vision. You need trial lenses in a fitting set so you can try different lenses on to see what fits the patient the best, do your over refraction and figure things out as far as what you need. And you're going to need sinks to clean your lenses in the dispensing area especially, and you're going to wash your hands and clean the lenses, and you know, you need that for sanitary reasons. You've got to have a sink. Okay, so you've got to have plumbing. Okay, and a phoropter. That way a trial lens set is great, especially when we're talking about trial lens in ophthalmics. That set is great to have, and you can hold up individual lenses, but a phoropter is so much quicker and so much handier because all of those lenses are built into a machine. Okay. Radioscope. Hardly you hear about those anymore, but you can test the base curve with a radioscope. And a lens magnifier, a simple little magnifier that's made for contact lenses to be checked. You can check the curves on the lens, and you can check whether you have a good, nice edge on the lens or whether it's got a problem. And you need to learn that. And all the books are going to cover that and how you use a radioscope and how to use a lens magnifier. And you need those. Once you've learned how to use them, then you need to use them because it's going to help you solve problems for the patient, make sure everything's right for the patient. Okay? Don't be reluctant to modernize your equipment. You want some looking stuff. It doesn't have to be necessarily brand new, but my wife said she wanted exercise, and she said she wanted to, you know, she liked getting out in the sun to mow the lawn, so I built her a riding lawnmower. Ha ha ha, ha ha ha. Are you laughing? But, you know, there's better equipment than that for mowing the lawn, okay? So you want to, just because it works doesn't mean that it's going to impress the patient and you're going to get more business. So you want something you can train the employees with easily, and you want something that impresses the clientele that comes through the door as well as does the job for you in a very practical way, a very fast way. So when you're taking a keratometer reading, what you'll notice here is you'll notice that this 12 millimeter cornea roughly, you're only getting a plot point horizontally in a 3 millimeter zone across the lens here where these two little targets are the pluses. And the minuses are what you're measuring here in the vertical. So you've got a horizontal measurement and a vertical measurement in about 2/3 or maybe 40% of the pupil. And that's not, you've left out all this information here, but a keratometer is a very basic instrument that you're going to need to measure to fit contact lenses with, okay? And it's a very inaccurate measurement. It's just a starting point for you to select a first lens. It's not the final end point that's really going to give you the information. A topographer is going to take a whole lot more information. The worst topographer takes 10,000 plot points. The best topographer, takes more like 30, 40,000 plot points, and there are some that go into the hundreds of thousands of plot points now that are out there. And you need this if you're going to be a true contact lens specialist, if you're going to specialize in contact lens fitting. And here's what I'm going to show you. That little circle right there is the keratometer area, that black ring in the center here that I'm pointing to. That's what you would measure in the keratometer. But look what you missed. If you'll notice these colors in this axial map, this is an axial map, you will see that it's red and yellow down here, which means that's the apex or the steepness of the cornea. You missed all that in your K reading. It looks normal. You ordered up your contact lens for a normal eye, but it's not a normal eye. It's a beginning keratoconus. So you missed it. You absolutely missed it. That's why topography is so important. Okay. And a biomicroscope is something else that, which is a slit lamp, which is something you're going to want to need. Okay. You need to check. Need to be able to check before doing any of your contact lens fits. You can look at the anatomy and physiology of the eye. You can flip the lids and see if it's healthy. You can see if it's unhealthy under those lids. You can look at the tear film there. You can see if the patient has good tear film. There are things you can do with fluorescein in the eye to do a breakup tear test and look at it with your blue light, your cobalt blue light, which is your ultraviolet light. And you can see how fast that tear breaks up, whether they have a dry eye or whether they have a nice fluid eye, and if the quality of the tear is good, or if there's things floating around in that tear that look like debris. This would be a lot harder to resolve for the patient wearing contact lenses than someone that has a nice, healthy, even tear film that doesn't have the debris. Okay. There are used models out there. There's a whole lot of practitioners that want the latest and greatest in their technology, and they order the latest and greatest in a slit lamp because they're doing more than fitting contact lenses with theirs. What you need is a good quality slit lamp that you can look at the health of the eye on the surface of the eye and also fit the contact. You're not going to do surgery. You're not going to do any of those things. You're basically looking at contact lens fits, the goods and the bads, and a good slit lamp is not as expensive as it would be if you bought a brand new one with all the bells and whistles. Okay. I'll go into how to use the biomicroscope in another presentation. We'll go into just exactly how you do that. And it's very important that you learn the technique. And there are online learning things for the biomicroscope as well as textbooks. Okay. So you're also going to need supplies such as for rinsing and cleaning the lenses. You're going to need those solutions. You're going to need care systems to dispense the lenses to the patient. If they're not going to throw them away every day, they're going to have to disinfect, and they're going to have to clean the lens and make sure that things work right. So you're going to need those things in your office to hand out, as well as a method for them to order them online if they like, which is what most people do nowadays rather than go to the store. So that way you can control also whether they're using the right solutions, because when you go in the store and you look at that wall full of solutions, they're going to look for the bargain sometimes, and they're going to buy the wrong solution for their contacts, and it's going to either mess up their eye or mess up their contacts or both. So you want to make sure the patient's using the proper solutions. So you want trial lenses that you can try on the patient. You want GP fitting sets, especially on these irregular corneas. You're going to want a scleral lens fitting set if you're going to fit scleral lenses, so you can decide where you need to steepen the lens, flatten the lens, do whatever it is for this irregular cornea. And there's different scleral shapes out there too, so you want to try these lenses on the eye and look at it in the sclera and see how it's fitting way out there at that 16 millimeter level, or that 15 millimeter level, or that 18 millimeter level of a lens that you're fitting that's huge on this eye. Okay? And you're going to need contact lens cases to store things in. The DMVs that are listed there, a DMV is basically a plunger, if you want to call it that. It's what you can use to remove the lens with, but in scleral lenses there's DMVs that are built for even insertion. So you can have inserting with DMVs where it's easier to hold the lens, because this huge lens needs to be filled with saline and none of it spilled out, because there's no tear exchange during the day behind this scleral lens. so you're filling the bowl up with what's going to be there for the day. So you don't want to spill any out of there. It also creates bubbles if you spill some out of there, and a bubble can be a real issue on trapped behind the lens, an air bubble. But the DMVs are very important for insertion and removal of these lenses. So what's going to be the cost of square foot where you are? You need to know that. You need to know that. That's how you can figure out whether you're going to be profitable or not. Okay? You're going to need that sink in the room. You're going to need enough space for a refracting lane. Okay? You need a room for that. Okay? How about liability? Do you have a MD in-house with you? Are you working for that MD, or is he working with you? Are you partners? You can work under the license, his or her license, if you are working together. So that helps cover a lot of your liability if you have a medical doctor looking at these corneas as well as you. Okay? Optometry also, same thing. You can work under their license. So are you going to get MD referrals? You're going to get OD referrals. What are you going to get? My experience is that optometrists they want to do it themselves. So, and that's fine, and they're very qualified. So you're not going to get probably a lot of optometric referrals. You're going to get more referrals from a medical doctor who most likely doesn't want to do contact lenses. Okay? Are you going to have an optometrist in-house to cover you? Are you going to get glasses RXs as well as contact lens RXs from this optometrist? And yeah, that's another choice. Well, you're definitely going to need more space for that. You're definitely going to need that refracting lane. Okay. Optometric referrals, are you going to get some of those? If you're good enough, you'll get some, but probably not a tremendous amount. Okay. So to summarize this whole thing, do you want to be a contact lens specialist? Let me tell you, I have done well in contact lenses. Everybody says there's no profit in contact lenses. So, you know, I've not only paid my mortgage all these years, I have put 2 children through college. I have lived a very, very good life very well by specializing in contact lenses. But all these things that I've covered, I had to take into consideration when I was in business for myself. Okay, and I was in business for myself for 18 years. And then I became an employee. I went into industry rather than being, you know, in private practice. But I did private practice for 18 years and did quite well. And that was the period of time when I did get all my kids through college. Okay. What's it going to cost you? We went over some of that, but there are some unknowns in there. How much is your rent? How much is going to be your lights? You know, we're saying that with a refracting lane and with topography, you're probably going to spend somewhere between $60,000 and $70,000. But is that your total cost? No, that's not your total cost, because you have labor involved. You have, you know, you have your insurance, you have your lights, you have your utilities, you have all of those things. So there's a cost involved. What, where, and how can the best training and knowledge be accomplished? I went over some of that. But you've got to study. You've got to read the books. You can't depend on somebody else just to teach you. You also have to fit some lenses so that you know what you're doing from experience. And you'll have to make some mistakes. Yes, you will make some mistakes. That doesn't necessarily mean you're going to do any harm to the patient, but it's going to cost you some money for sure when you make those mistakes, because sometimes you lose your profit by learning. You just have to give a few things away after you've made some mistakes. Okay? Will this bring more eyewear sales into your place? I'm convinced thoroughly it does. I've seen it. It does bring more eyewear sales into your place. And the reason being is they have family. They have friends. They talk about what a specialist you are. And they will bring their friends not only for the contact lenses, they'll bring their friends to come in and get glasses. Okay? Will this retain more loyal patients and customers? If you're a specialist and you know how to do it better than most anybody else in your community, you better believe it. You will retain more loyal customers and patients. Okay? If you have questions, I'll be happy to answer them. I gave you my my address at the beginning, and I thank you for your attention. And you know, there's a world, just to summarize, there's a wealth of contentment and satisfaction and self-purpose in fitting contact lenses, especially for those people who, not just because they don't want to wear glasses, that is a motivation for some, but for those who you can make see better than you can see in a pair of glasses, and you can free them up so that in certain activities and certain life functions they do better with contact lenses. And thank you for your attention. And this concludes. Now, by the way, you'll need to take a 20-question little quiz to complete your CEC, and that will be coming to you also online. So thanks for your attention, and I appreciate being able to present this information to you.